So I guess that's certainly the million-dollar question, isn't it? And certainly the French government have made a huge statement by providing free care, really, for a period of 3 years, completely free prevention. And I'm sure that was influenced by the white paper. And NHS England quite clearly are starting to recognise the need for contract reform in NHS dentistry. There are huge issues around inequalities and access to care, and also the impact of oral health on systemic health and general well-being. And that is something that needs to drive a complete change in the way we deliver NHS dentistry within the country. So there are huge general health implications from periodontal inflammation, and inflammation is the word really, and therefore preventing periodontitis, managing gingivitis will without doubt give us substantial reductions in inflammation, not just in the mouth, but in the body in general. There were significant health and economic gains to come from managing periodontitis in people with diabetes. Recognising the evidence base that periodontal treatment does reduce complications of diabetes, it improves diabetes control and provides an overall benefit, both health-wise and economically, for people with diabetes. And we're seeing similar data emerging for rheumatoid arthritis and also for cardiovascular diseases. So for me, the most important aspect is to personalise the care message for each individual patient. Every patient's different, but they do have other risk factors. They may, for example, have poorly controlled diabetes, they may be a smoker, or they may have suboptimal plaque control, or their plaque control may not be good enough for their level of risk and for their genetics, if you like. So we need to coach them. And that coaching is not just giving oral hygiene instruction, it is going through a training process for their mouths to show them what the right techniques are for mechanical plaque control. Because that mechanical plaque control is the bedrock, really. And once that's in place, we do know that there can be additional significant benefit then from the use of chemical adjuncts present in toothpastes and in mouth rinsers. So I'm going to start off very briefly by discussing the Economist white paper. I think most people are familiar with it now, but for those who aren't, I'll spend a few minutes going through that, and then discuss the recent WHO report and the vital importance of prevention. I'm going to emphasise the importance of clinicians really feeling empowered to do what they do, to feel confident because they know the policy, they know the directives, and they know the evidence and the knowledge base and the data behind those recommendations. I'm also then going to go on to demonstrate how gingivitis can actually have systemic health consequences, as well as oral health consequences. And I'm going to really finish off, I guess, by focusing on precision medicine and what collaborative working looks like between medical and dental teams. That's something that the white paper called for. It's something that is written in the NHS commissioning standard back in 2019 on oral care for people with diabetes. And it's something that the World Health Organization and the Wonka Group guidance is really providing very, very strong advice on.